Hi, my name's Jo from the Hay Runner, and this is the video for my shoulder assessment. Before I start, before the client arrives, I'm going to just talk you through the PPE that I would usually be wearing. The client I'm using is actually a friend, and she's from my COVID bubble over here in Wales. So we've been mixing for the whole of time through lockdown, so she won't be wearing a mask and I won't be wearing my PPE. However, I have cleaned the table with antibac wipes. These are biodegradable. I've also got some hand gel, and she will have arrived having washed her hands because she only lives just around the corner, and I will also be using this, and I've also washed my hands 20 seconds with soap. So my normal PPE for working with anybody would be gloves, mask, visor, and also an apron. So my client phoned me originally complaining of shoulder pain after she'd had an accident. She went to hospital, had an x-ray, it didn't show anything, and they said that it was probably a rotator cuff tear. As time's gone by, she's had it immobilised in the sling because she just couldn't move at all, it was too painful. So sleeping's been really difficult, getting dressed has been really difficult. Over time she's been able to come out the sling, and some movement has returned. However, in certain movements it's still quite painful, and she's also noticed that she started to develop a lump on her shoulder. So when she arrives, I'm going to do a functional screen. We're going to have a little chat about what happened, and then I'm going to do a passive, active and passive resisted tests, plus some specialist tests to try and find out a little bit more. My feeling at the moment is that it may be an injury around the AC joint. It could be a ligament sprain, or a partial separation or a total separation, depending on how the tests come out and how she responds to it. Then we'll form an exercise plan to hopefully start to strengthen areas around the shoulder, to strengthen the muscles around the injury, and also to try and get some range of movement back where she's actually finding it a little bit weak and a little bit difficult at the moment. So I shall let my client in shortly and we will resume the video. So my client has arrived, and as I said before on camera, we do know each other, so we're not going to be wearing PPE because we've been in a bubble for lockdown. But for the purpose of the video, she is a new client to me. So on arrival, we are going to antibac our hands. So if you'd like to just take some antibac. Okay, so I'm Jo from the Hay Runner, and we spoke earlier on the phone about your shoulder injury. Can you just tell me a little bit about how the injury happened?
Yes, I was in the field walking my dog. He spotted a sheep at the other end of the field, pulled on the lead, jerking me. I wasn't expecting it, so I fell over onto my shoulder.
Okay, and then you went to hospital and you had x-rays, and I've seen them, and there doesn't appear to be any breakages. But you had your arm immobilised for a while?
Arm was immobilised in a sling for a while. It was very painful, but gradually the pain has subsided a little.
Okay, and now you started to notice, as I can see, on the shoulder just here, there is a lump appearing. Does it hurt to touch?
There is a lump appearing, but it doesn't hurt.
Okay, that's fine. And can you just tell me about any what movements are difficult for you? Can you just show me a little bit?
It's the range of movement of the affected arm.
Yeah.
So, for example, putting the arm behind my back, trying to put it through the sleeve of the coat, raising it above my head, particularly if I'm going backwards. Obviously, can't do any free weights exercises anymore.
Yeah.
In any direction, really. It's a kind of a stiffness and a relaxation of the range of movement.
Okay. So over time you've seen this lump appear, so the lump wasn't there to start with. Okay. So if you could just move into the centre of the room. I'm just going to have a little visual look just to see. I can see here that there is a lump on the shoulder compared to the other one. And this is around the acromioclavicular joint, so the AC joint, as I'm going to refer to it from now on. This is quite common in the range of movement with this particular sort of injury. So it may be possible that it's a sprain of the ligaments around the AC joint, or we could have a partial separation or separation of the ligaments as time goes on. The good thing is there is some movement back, although there is pain. So I'm just going to do an assessment of the different movements around the shoulder so we can see what range we have comparing each side. So I'm going to take the client through now a range of active movements. So I'll be observing after I've demonstrated the movement to the client. So the first one I want you to do is just from the arms at the side, just raising up and then coming back down again nice and slowly. And just let me know how it feels.
You can do it a little bit stiffer on the right hand.
Okay, and back down again. That's lovely. I'm just going to go around the back as you do this. If you like to go again. Okay, and back down. Lovely. So this time, it's the same thing, but I just want you to take the arms back to the fullest range that you can, and then just bring them back down to the side. Again, just give me a little commentary on how it feels, and I'm just going to observe you from different angles.
Not really painful, but definitely slightly stiffer on the right,
Yeah.
not quite as far.
Okay, and bring it back down, and if you can just go again, and we'll observe you from the back. That's lovely. And back down again. Okay, this time I'm going to take the arms out the side to about shoulder height and then slowly bring it back down again. Off you go. Okay, as I can see from this, the right one isn't going up quite as high. And back down again.
Definitely feels stiffer on the right.
Yeah, and let me come around the back, and if you can go again. That's lovely. So the right arm is definitely a little bit lower than the left, and as the client said, it's feeling a little bit stiffer. Okay, this time I just want you to see if you can get your arms all the way up. How far you can go. Okay? Don't force it.
Beginning to get painful, and I can feel resistance now. I'm actually having to push against it.
Yeah. So that's about as high. Yeah. Okay, just bring them down again. Are you able to do that one more time for me?
Mm-hmm.
Okay, so I'm just going to stand around the back and just observe. Okay. There's much more range in the left hand side than there is the right. Okay, this time, all I want you to do is tuck the arms into the side and make sure that this part of the arm doesn't leave your side, okay? I just want you to take your arms out and then just bring them back in again. Try and keep the elbow tucked in. Only take them as far as you can. That's fine, and then just bring them back. And let me come around this side. Okay, off we go again. And bring them back in. And bring them down. Okay, we have 2 more exercises to do, and you're going to do them one arm at a time. So we'll start with the good arm, okay? And all I want you to do is just take the arm and place it behind the neck, and then bring it back down. Lovely. And I'll come around the side one more time. Okay. And now with the right arm. And that's the kind of action you would use if you were trying to get your arm through a sleeve or something like that. That's fine. So we've got about 8 inches gap at the top where the hand can't come down to the neck. So the next one, this time you're going to take your hand round the back. Lovely. And the other side. Yeah. And again, the arm isn't getting any further then just across the waist. It's not getting any further up there. Okay, that's lovely. So thank you for that. We're now going to do another set of exercises. So I can actually see how far the range goes when I'm assisting you to do it. Okay. Just one thing, it's really useful to notice, because quite often a client can't see behind their back, just to see if there are any moles, maybe that have grown a little bit bigger, that if you're slightly concerned about, you can take a photograph with the client's phone and then they can have a look, because quite often people don't notice things on their back, so that's just something to bear in mind. So we're now going to continue with the assessments. These assessments are going to be passive, which means I'm going to assist the client with the range of movement. I want you to tell me at any time if you feel that you can't take it any further, or you want me to stop, or it's starting to hurt.
Okay.
And it also gives me an idea of what's going on as well. Okay? So can you just shuffle up into the middle just slightly? That's brilliant, just gives me a little bit more room. So I'm going to place my hand on the client's shoulder, just locking in the scapula around the glenohumeral joint, and then I just want you to place your hand in mine and just rest it, just let it become a dead weight, and I'm going to do the movement, okay? And at any time you want me to stop, then just say. So we're going to start off with flexion and extension, lovely. And then back to the centre. So I'm just going to lift it up to the side. You okay? Excellent. And then we're going to come back down into abduction. And I'm just going to take it out again a little bit, and from an abducted position, I'm just going to externally rotate.
Stiff there.
Yeah, okay. I can just feel it stiffening up a little bit. Internally rotate. And then if you can, we're just going to take it behind. You tell me how it feels and if you want me to stop.
That's as far as I can.
Yeah, okay, that's lovely. And then one more. We're just going to horizontally abduct and take it across. That's wonderful. Okay, the same on this one. If you could just shuffle back just a little bit. Perfect. Again, I'm going to place my hand just to lock the scapula over the glenohumeral joint, over the shoulder capsule. So, again, just let the arm go nice and dead. Just lock the elbow into mine. And then we're going to just flex the shoulder. Lovely. And then extend. And then bring it back to centre. Just take it out to the side. Don't assist me. Don't assist me. Let it go dead. That's it. Lovely. And then abduct it back down. And then from an abducted position, I'm just going to externally rotate and internally rotate the shoulder. And if you're able, I'm going to take it back. That's lovely. Much better range of motion movement on this side. Bring it out. And then when you just abduct it again, we're going to do a horizontal abduction across the shoulder. That's lovely. So I could feel the resistance on some of the movements on this side compared to this side, which has a much freer range of movement in all areas. So now on the third set of assessments, these are active resisted. So I'm going to be trying to prevent the client from moving in any one direction. Okay. So again, I'm just going to place my hand on the glenohumeral joint, okay, just palpating. I want you to make a fist. That's lovely. So I'm going to place my hand around the front here, and I want you to stop my hand pushing your arm back, so pushing. That's lovely. And again, tell me if you have any sensations, feeling, or you want me to stop. Okay, and relax. So I'm going to bring my arm around the back. And I want you to stop my hand pushing your elbow forwards. That's lovely. Okay, so just going to abduct the arm slightly. And now what I want you to do is, again, I'm going to stop my hand from pushing your arm up. So you need to push down onto my hand. Okay? That's lovely.
Hurts a little bit.
Yeah, and relax, and we're going to do it the other way. So push up. Lovely. Okay, so just tuck the arm in here, and I'm just going to take hold of your elbow. Just cup your elbow in my hand. If you bring the arm up, so I want you to prevent my hand from pushing your arm inwards. Okay, and out. So this is external rotation. And then we're going to go the other way, so push into my hand and prevent it from pushing your arm out. Lovely. Okay, I'm going to do the same on the other side for a comparison. So just make a fist. Again, I'm just going to place my hand, palpate the glenohumeral joint, and then I want you to prevent my hand from pushing your arm backwards. That's lovely. And then the same thing, I'm just going to cut my hand there, and I want you to push backwards. So that's extension. And then we're just going to abduct the arm out slightly, and I'm just going to place my hand on the elbow, and I want you to prevent my hand from pushing your arm up by pushing back into it. That's really good. And rest. And one more, I'm going to put it up here, and I want you to push up into my hand. Lovely. Okay, if you can just tuck your arm down, I'm just going to take, put my hand to support your elbow, and then I want you to push out into my hand, so we've got external rotation. Stop my hand from pushing your arm in. And relax. And the same going inwards, so internal rotation, and if you would like to push against my hand, stop it from taking the arm out. That's lovely. Now, although there didn't appear to be too much discomfort, there was a palpable difference in the strength on this side, especially in rotation and abduction, than there was on this side. So now we're going to do a specialist test called the scarf test, which is a test that really works well to see if there is any pathology with the AC joint. So we can start off with the good arm, and we're just going to bring it up to shoulder height, and then I'm just going to wrap the arm around you. That's lovely. So with this one, as this is the arm that has the injury, we're looking for the end of range movement, and if there's any problem with the acromioclavicular joint, then it is likely to be at the end of range. So just going to bring it up, and we're going to do exactly the same. Just tell me when there's any problems.
Scratchy, stiffer, not very comfortable at all.
Okay, that's lovely. And bring it down. Thank you.